Here's a crazy thought. What if a health insurance company in your area went out of business and your monthly premium actually went down? Sounds impossible, right? Well, today we're diving into a paper that won the prestigious Frisch Medal for explaining exactly how that can happen. It's a paper that completely changed the game for how we understand competition in healthcare.
Okay, so here's how we're going to break this down. First, we'll tackle the big puzzle that had economists scratching their heads. Then, we'll look at why the old ways of thinking just didn't work. And we'll get into the brilliant new idea that changed everything. After that, we'll look at the surprising results, and finally, why this all matters for policy and economics today.
All right, let's jump right in. We're going to start with the central question, the one that policymakers have been wrestling with for decades. And, it sounds pretty simple on the surface, but as you'll see, the answer is, well, it's anything but.
So when health insurance companies compete with each other, who actually wins? I mean, who gets the better deal? Is it you, the patient, getting lower premiums? Is it the hospitals getting paid more for the care they provide? Or do the insurance companies just pocket the difference? You see, the answer isn't obvious at all, and that's because healthcare is just not a normal market.
It's really more like a complex game with 3 different teams, and every move one team makes affects the other 2. First, you've got us, the consumers, choosing an insurance plan. Then the insurers have to build their networks and bargain with hospitals. And finally, the hospitals are in their own negotiations, trying to set their prices. The key thing here is that all these decisions are tangled up together. One move and the whole board changes.
So for years, trying to figure this market out was, well, it was kind of like trying to understand a 3D object by only looking at its shadow on the wall. You could see bits and pieces, sure, but you were never really seeing the whole thing.
See, the old economic models, they had a big blind spot. They treated insurers and hospitals like they were operating in totally separate worlds. What they missed was the most important part, that prices in healthcare aren't just stamped on a product. They're the outcome of this intense strategic bargaining, a whole web of negotiations between everyone involved.
So it was obvious a whole new approach was needed. Something that could finally see that full, 3-dimensional picture. And that is exactly what Kate Ho and Robin Lee delivered in their groundbreaking 2017 paper. What they did was build a single, unified model that brought all the moving parts together for the first time. It looked at how we, the consumers, choose our plans. It looked at how insurers compete for our business. And, this is the really critical part, it modeled the intense bargaining that happens between insurers and hospitals. It even figured out how hospital networks get formed because of those negotiations. The whole system was finally seen as dynamic and interconnected.
What they basically did was create a digital twin of the entire California healthcare market. Think of it like a virtual sandbox. For the very first time, they could actually run experiments. They could poke and prod the system to see how all those invisible economic forces really work together.
And okay, when they started running simulations in this virtual world, the results were just fascinating. And honestly, they were totally counterintuitive. What they found was this hidden force that was driving pretty much everything.
And that hidden force, it was all about bargaining power. Specifically, it was about something economists call countervailing power. The idea is pretty simple. Imagine a hospital is the only one in town. They're a powerful seller, so they can charge really high prices, right? But what happens when a massive buyer, like a huge insurance company with 1 million customers, walks in? They can push back. They can say, look, give us a better deal or we're taking all these patients somewhere else. That is countervailing power.
Okay, and this is where it gets really wild and just blows up what we thought we knew about economics. The old rulebook says less competition is always bad for us, right? It means higher prices. But their model showed something completely shocking. It showed that if a small insurance company leaves the market, the bigger ones left behind can gain so much bargaining power over the hospitals that prices, both what hospitals charge and what you pay in premiums, can actually go down.
And their simulation for California proved it. They digitally removed a small insurer, Blue Cross, from the market, and guess what happened? The premiums for one of its competitors, Blue Shield, actually fell by over 3%. So why did that happen? Well, with Blue Cross gone, Blue Shield suddenly had a bigger pool of potential customers. That gave them more leverage with the hospitals. They could demand lower prices, and then they passed some of those savings right on to their customers. And this right here really gets to the heart of their discovery. When you ask what actually determines what a hospital charges, you might think it's their costs, right? Well, that's only about 11% of the story. The vast majority, nearly 60%, comes down to what they call the price reinforcement effect. And that's just a fancy way of saying it all comes down to bargaining power. The negotiating battle between insurers and hospitals, that's what's really setting the price.
And look, this wasn't just some interesting thought experiment for economists. This research became a whole new blueprint, a new way of thinking for the real-world policymakers and regulators who have to manage this massive, complicated market.
All of a sudden, government agencies had a powerful new tool. They could now predict with way more accuracy what would actually happen if two big insurance companies wanted to merge. It completely changed the rules of the game and set a new gold standard for how to analyze the entire industry.
And this stuff really matters, right down to your own wallet. Because the model also showed that even if your premiums don't go up, less competition can still hurt you. Just the loss of choice, not being able to find that one plan that's a perfect fit for you and your family, that alone could be costing you up to $200 a year in lost value.
Now, a paper this big doesn't just appear out of thin air. It was really the next logical step in this whole revolution in economics that we've been following in this series. It stands on the shoulders of giants.
You can really see this clear evolution. Early on, economists were figuring out how to model just one piece of the puzzle, like if a company decides to enter a market. Then they got sophisticated enough to model how we choose our insurance plans. But what Ho and Lee did was take that final massive step. They modeled the entire strategic game, with all the pieces moving at the same time.
And that right there is the incredible power of modern econometrics. It's like giving policymakers a crystal ball. They get a virtual lab where they can test out huge economic decisions, like approving a merger or creating a new healthcare marketplace, and see the consequences before it affects millions of real people. So, after all that, what's the big takeaway? It's this. Ho and Lee's work completely changed how we see this market. They proved that in healthcare, prices aren't just posted on a sign. They are fought over. They are negotiated. And if you ever want to understand the price of healthcare, you have to first understand the bargain.